It's been a banner year for multiple myeloma this year, with 4 new drugs approved for the therapy of patients who have relapsed. 2 of those are proteasome inhibitors. One, Carfilzomib, the approval was extended based on the ASPIRE study results, which showed that Carfilzomib, in combination with lenalidomide dexamethasone, quite dramatically outperformed the control arm. That was approved as a first 1 to 3 prior therapies. We had another oral proteasome inhibitor approved within the last few weeks, and the beauty of that, it is an orally delivered drug once a week. And again, in this trial called Tourmaline, the combination of this drug called Ixazomib in combination with lenalidomide dexamethasone also demonstrated important benefits. And particularly important was that it seemed to be able to overcome some of the highest risk features of multiple myeloma, such as deletion of chromosome 17p, which I think might reflect the fact that you can stay on the drug for longer periods of time than you could with drugs which cause significant neuropathy. Then we have 2 drugs which have new mechanisms of action, both monoclonal we have 3 drugs with new mechanisms of action, 2 monoclonal antibodies, and 1 other oral drug, which is a histone deacetylase inhibitor called Panobinostat, which was approved in January. And we're waiting for some updates on that, which are particularly interesting with respect to toxicity. Because with combining Panobinostat with Carfilzomib or subcutaneous Proteasomib, it appears that the toxicity that people were concerned about can be abrogated. Most exciting are the 2 new monoclonal antibodies, Elotuzumab and Daratumumab. Elotuzumab is now approved for patients who've had 1 prior line of therapy. It is a monoclonal antibody which activates NK cells and which targets myeloma cells through a surface marker called SLAMF7. A trial called Eloquent, led by Dr. Loniel, showed a very important increase in progression-free survival. This morning, we learned also contributes to an overall survival advantage, which is the first one of these trials to show that, and very important for reimbursement and other issues. Finally, a drug we're all very excited about is Daratumumab. It's a monoclonal antibody targeting CD38 on the surface of myeloma cells. It has a very impressive single-agent activity in very, very heavily pretreated patients. And we expect that this drug, which is now approved in the United States for patients who've had at least 3 lines of therapy, will very quickly move into the frontline setting. And at this meeting, we will see trials where Daratumumab is being combined with other drugs both safely and effectively. So the overall message for myeloma physicians and patients is this is a dramatic time in myeloma. The art of myeloma management has become more important, deciding which patients suit which drug, because we have many options now. And I would encourage patients in particular to look for myeloma physicians who are expert in this disease.